homework. Homework. This is right here. And then we're going to go over some of 42, but we're going to finish it up next week. All right.
Put it up.
15 minutes.
Where is homework today? Why shouldn't you get the paper? Why shouldn't you get the paper?
Thursday.
Well, you get Thursday. I ain't got no homework. You should have been on that one.
I think I got it.
I've done that before. When she posted it, I was like, I'm trying to show people.
Miss Green. Yes, Stinson.
Okay. See, Miss McCoy told us that we were going to have a midterm, and she never said anything about homework. On Thursday, a bunch of girls come up here and do.
You're right, 4.
Four girls come up here to do their practice, that next Thursday, and she gave them and said, oh, we have homework, scanning homework, and handed 4 of us scanning homework. And the only reason we found, everyone else found out because she posted it on Facebook. So how would you go, I mean, what if people didn't know about it?
her about it. She doesn't think we care.
She didn't give it to us in class, so how would she was very happy. We wouldn't have known about it unless Andrea would have posted it.
Was it on your syllabus?
No.
That you guys had homework?
No, because it
I mean,
was
she didn't give it
mixed
to
up.
us at all.
It was
It was,
homework.
no, but she mixed it up though because we were actually supposed to have midterms last week.
And she.
No, this week.
This week, whatever, it was all mixed up.
We
So no, it wasn't on syllabus.
It was confusing.
I mean, that wasn't hard homework, but she would have it in class if she
It's
was.
just confusing, what if you don't have faith?
Tell her that that's true.
I'm pretty sure. I mean, I think we all do.
But I got Facebook.
There you go.
That's my.
I've been trying to get it out. Okay. I've been trying to get it out.
Julie wouldn't give up her number.
She will never give me her number, or nothing, I can't get a hold of Julie.
Well, I don't even want her to give us your number, so we can leave your next number.
All right, guys, chapter 42, page 1001.
She's leaving a trail.
It's our because you didn't eat it on the ground.
I thought it was 8-second rule. Really though, I mean, if you didn't see it on Facebook, right, and
I don't have any here.
Oh, you can, it doesn't. Yeah, it doesn't.
y'all crack me up.
It doesn't really matter. You can circle or write it out. however.
But my brother's struggling.
Oh my God, what is that? Okay. All right, the anatomy of the ovaries. Just highlight those 6 lines. All right, but the ovaries are paired, almond-shaped structures situated one on each side of the uterus, close to the lateral pelvic wall. You have 2 ovaries, one on each side. The ovaries can vary in position and are influenced by the uterine location and the ligament attached. Finding the ovaries when we go into have midterm on Thursday, midterm scan on Wednesday. But the following week, you guys will have to start doing the ovaries. We'll start with one ovary and then add on the other. But that's like, you think it's tough, finding those ovaries is tough. Because they can vary in their location. One person, you may find them pretty easy, the other one they may be somewhere different. And in the anaflex midline uterus, the ovaries are usually identified laterally or posterolaterally. So there's just like out to the side for lateral, or then out to the side and then down a little for posterolateral.
What are we in the?
2001. And now we're on 2002.
Okay.
And when the uterus lies to one side of the midline, you know, levovertis to the left, dextrovertis to the right. The ipsilateral ovary, what does ipsilateral mean? Same side. What's the opposite of ipsilateral? Contralateral. Good job. Often lies superior to the uterine fundus. So whenever you see, you may see it, the seniors, when they go, a lot of them in there have uterus is tilted to one side and the ovaries up top. But so whenever you see your uterus like in long, in midline, and it's like you see something up here, you're like, what is that? It's actually like an ovary. But it'll be like up top, like right here. So you don't want to include the ovary in that measurement whenever the uterus is tilted to one side. It like pushes that ovary superiorly. And in a retroverted uterus, the ovaries tend to be lateral and superior near the uterine fundus. So again, they're out to the side, and then they appear superiorly near the fundus because it's bent backwards, so it's going to be closer to those. When the uterus is enlarged, the ovaries tend to be displaced more superiorly and laterally. That uterus, it's enlarged, so it's getting wider and it's getting taller, so it's going to push the ovaries more superiorly or more laterally. It's just pushing them and displacing them out of their normal location. And then following a hysterectomy, the ovaries tend to be located more medially. They kind of migrate more towards the middle where the uterus was at one point. And then they can even be directly superior to the vaginal cuff, which, did I show you guys a picture of vaginal cuff?
I don't really understand what that is.
Yeah, I didn't know what that was.
It's where you have a hysterectomy, the cervix is taken out. I thought I had a picture.
Yeah, that was on the test. So.
Less than 2.1, what? Yes.
I don't get what it is.
Yeah.
What is it?
2.1, That's it. But it's where, like, if the uterus and the cervix was removed and you just had the vagina and you had your vaginal cuff right here. This is what you would see. It'd be kind of like a bright white line. And it can be, you'll measure it. You don't want it to be thickened because it can have malignancy. It can have a malignant process on there, especially someone that had like cervical cancer or endometrial carcinoma or something like that. And then that's why they had the hysterectomy. Then you really want to check that vaginal cuff. And that's just, it's because the uterus and the cervix was chopped off and then they just sewed it up. And so this is like scar tissue. That's why it's bright white. And so that's just what the vaginal cuff is. It's like a cut. Okay. Normal sonographic appearance. The normal ovary has a homogeneous echotexture, which may exhibit a central, more echogenic medulla. So the medulla is on the inside, the cortex is on the outside. Same thing that you'll guys learn with like the kidneys, the adrenal glands. Whenever you have an organ like that, the cortex is the outside, medulla is the inside. Small anechoic or cystic follicles may be seen peripherally in the cortex. Those are our chocolate chip cookies. Those are some good pictures on the next page. The appearance of the ovary varies with age and the menstrual cycle, just like the endometrium. It varies with their cycles. The ovaries have their own cycles. What are the ovarian cycles? Luteal.
Okay, that.
And follicular.
Oh, that's it.
Proliferative is endometrium. The proliferative corresponds or correlates with the follicular phase of the ovary, and the secretory phase of the endometrium correlates with the luteal phase of the ovary. Okay? Alright, yeah, I'm telling you, that's like half of your OBGYN registry right there.
And that's how much
guess because you have the same names for, don't like two different ones have the same worded phase, or they all include
What?
Never mind, didn't get it.
I mean, they have,
well, but I don't understand.
Like the ovarian phases, and the endometrium phases,
Uh-huh.
and the menstrual phase, whatever.
oh, I gotcha,
Then
yeah.
they have
Men-
two with the same word, like proliferative.
I mean, you can say like the proliferative phase is kind of divided into early, mid, and late phases. Is that what you mean?
No, never mind. Just keep on moving.
Hi.
Okay, during the reproductive years, 3 phases are recognized sonographically during each menstrual cycle. This is important because the book's going crazy on me right here. Because it's talking about ovaries. During the, and it says early proliferative phase, but that's endometrial. It correlates, I want you to just draw a line to early proliferative phase and write follicular phase. Because we're talking about the ovaries right here. It correlates with the early proliferative phase, yeah, sure, but we're talking about ovaries.
That's what I was asking. That's
Now,
where it
what
got
has
confused.
follicular phase up there?
Because I had changed it, so I was like, this
Oh.
is just.
So where it says early proliferative, talking about ovaries, that's when I got confused, because that was with the other.
Yeah, you kind of have to like, yeah, you kind of have to convert it, because that's talking about the endometrium. And so I have to try to throw you off or trick you, which I guess, the registry might pull something on you like that, but.
They didn't even say what they mean.
No, crap. Oh, did if I know.
How you gonna convert a phase?
Alright, okay, but during the follicular phase, many follicles develop and increase in size until about day 8 or 9 of the menstrual cycle. And this is due to stimulation by FSH and LH. Again, I know this is all review to you guys, right? You already know it from chapter 39.
Sure it is.
And cereal, the pituitary.
To what?
Huh?
Yeah, what was that?
What is it?
Pituitary.
Yeah, it gets secreted by the pituitary gland.
You go there.
You got one right.
1%.
That's all?
SSH and LH are secreted by the
And cereal.
pituitary.
What?
What is secreted that causes secretion of LH and FSH?
The, the luteinizing. The corpus lutein.
No, what'd you say? Yeah. That's it. And what is that secreted by? Very good.
Hypothalamus.
I don't even remember.
Okay, at that time, one follicle becomes dominant, reaching up to 2 to 2.5 centimeters at the time of ovulation. So if you see, a lot of y'all, whenever you're in there scanning, you see cysts pretty often. And that's because once a follicle gets to be about 2 centimeters, it's considered a cyst, but these follicular cysts, or you not even call them follicular cysts yet. It's going to be the Graafian follicle. It's that mature follicle. It can get up to 2, maybe 2.5 centimeters. So it can be thought to be a cyst, but it'll just ovulate and it'll go away. It's just part of being a woman. All right, skip the next 2 sentences. The other follicles become atritic after you have that one that becomes mature and it actually releases the ovum, and that's ovulation. The others become atritic and they start to atrophy and get real small and just go away. A follicular cyst develops if the fluid in the non-dominant follicles is not reabsorbed. So as it's going away, if the fluid isn't reabsorbed by the body, then it becomes a follicular cyst. All right, next column. Fluid. Okay, wait, here's an ovary. I know you got some good pictures of ovaries in your book, but just thought there's some more up there. See our little chocolate chip cookie? This is transvaginal. Honestly, you're not going to see it that pretty. transabdominally. But when we start looking for ovaries next week, here's transabdominal. Here's someone that has a hemorrhagic cyst. And it looks like they got a few little small simple cysts over here. But here's our uterus, here's our 2 ovaries. And then here's another ovary. So see how different this looks compared to that?
Yeah.
So this is transvaginal versus transabdominal. So just look for your little squished chocolate chip cookies. Alright, so fluid in the cul-de-sac commonly occurs after ovulation and peaks in the early luteal phase. And that's because after ovulation, all that fluid that's in the mature follicle, it has to be reabsorbed. But it's got to go somewhere first, and where is it going to go?
Zach.
Yes. The posterior cul-de-sac, which is also called, and yes, rectal uterine pouch. Good job, guys. All right. Following ovulation in the luteal phase, because as far as the ovary is concerned, we have luteal phase, and then ovulation at day 14. Follicular phase, ovulation at day 14, and then luteal phase. But following ovulation in the luteal phase, a mature corpus luteum develops and may be identified sonographically as a small hypoechoic or isoechoic structure peripherally within the ovary. So this can look very cystic, or it can look kind of, I've got some pictures on here that I'll show you about what a corpus luteum typically looks like. But it may have irregular with echogenic crenulated walls and contain low-level echoes. So it's kind of like it's folding in, it's got like little weeby-wobbies on the inside. I have a picture if you don't know what weeby-wobbies look like.
I don't think anyone knows.
Okay.
That was cremulated?
Yes, it does have the word.
Well, I'm just wanting to know, so I know what granular is. What the heck that means?
It's like weeby-wobby. You know? I'll show you. It's easier to show you. Less frequent appearances include a typical ring color Doppler pattern around the wall of the isoechoic corpus luteum. That's that ring of fire that I've talked to y'all about already. That you also see with ectopic pregnancies, where the blood flow with color Doppler just is like increased around. I have a picture of that. I'll show you too. In the absence of fertilization, the corpus luteum begins to undergo involutional changes on post-ovulatory days 8 or 9 and disappears shortly before or with the onset of menstruation. So if no fertilization occurs, the corpus luteum starts to, degenerate and just goes away eventually. On its own, it just kind of goes away. But if fertilization does occur, what happens?
Keep saying that.
It attaches to the wall, right?
Well, I'm talking about what happens to corpus luteum. Yeah.
Until the, placenta takes over.
Yes.
I'm talking about the baby.
I know, I figured that.
Yeah.
Which is right, but corpus luteal specific. It persists, and what does the corpus luteum do? Like, what's its purpose? Yes, it produces progesterone, and that progesterone is needed to sustain a pregnancy until the placenta is formed, and it's fully functional and can take over, and it does become fully functional right after that first trimester, so around week 12, 13. So you'll see a corpus luteum throughout the first trimester of pregnancy. What, Larry?
I'm just saying, that's crazy. That is so, when I was reading it, it was like that. This is so crazy because the corpus luteum is almost like dead, but yet it's still controlling stuff, man. That's just, yes. Wow.
The miracle of life, Larry. Larry's the most fascinated in earth women.
I was just like, wow.
I know why everybody's vomiting when they get pregnant. Okay. Here's some pictures. Alright, so this is kind of a crazy looking corpus luteum. They just kind of look all crazy. You're like, oh my god, that's cancer. It's not cancer, it's corpus luteum.
What? That's cancer.
What?
How do you know that it's
Where is that
corpus
even
luteum?
at?
I know it's corpus luteum because I typed in Google corpus luteum. But also, lab work, getting their cycle, like, because you always, when you do a GYN ultrasound, you always get their LMP. I know I'm not requiring you to get their LMP on the sheet. Maybe I will when I make stuff.
So you know what phase they're in.
I know. And you always ask beforehand so they don't freak out if you ask them in the middle of your scan. All right? What does LMP actually stand for?
Good job.
Okay. What? You just put some color on there and then it will light up with your little ring.
Yeah.
Here, this is typically what you see with a corpus luteum.
Okay.
This is typical. Like all this is ovary. Here you got some free fluid because it's ruptured. So because it's ovulation had to occur, the ovum came out and it ruptured, and now it's all crenulated.
Okay.
See how weeby wobby on the inside?
Weeby
Oh,
wobby,
that's
there
what
it
that
is.
How long's this down?
Well, it depends, or if the person's pregnant or not.
Yeah, but if they're not.
If they're not pregnant, it envelopes and usually takes probably about, I would say like a week during the luteal phase, and then it has to go down. Everybody's gonna be a little bit different.
Okay.
The speed that it takes. And then also depends on how big the actual follicle was.
So this is a week after.
This one, I don't know exactly how long
That's
this is
what you were
after.
saying.
Right.
Without a week.
Yeah. And then some people can have like persistent ones, and then they'll come in with like pain, but it'll eventually go away. It's just taking a little bit longer. But yes, this is typically what you will see whenever you see corpus luteum cysts. You see these all the time, and this is like textbook what they look like. This one's just kind of crazy.
Yeah, that looks like a bladder.
It's
Bladder. Like just the way it's shaped. Like I guess 'cause it's zoomed too.
Yeah, and this is transvaginal too. And that's transvaginal too. Yeah, that's also transvaginal. But see a little ring of fire?
Well, see, this is not realistic to us.
Yeah.
But when you guys get out there, you're probably going to be doing transvaginal most often.
Well, it doesn't show up.
Volunteer and do this now.
How about now?
If someone wants to volunteer, we have the probe, we've got the cover, we've got all that stuff.
I would. I swear, I don't care what y'all are touching. I totally would. I'd rather have experience when we get out.
Well, I understand.
You know?
Alright, well, I mean, if you want, we can do that during lab. If you guys don't, if you're not comfortable with watching, you don't have to watch. So on both sides, you don't have to lay, you don't gotta watch. We'll have her covered, showing her who I
But can you see that same ring abdominal?
I mean,
Yeah, it just won't be quite as pretty.
Okay.
Okay. Are we in a good spot with the
Yes.
Okay, wait, let's get the sonographic appearances real fast.
You're up for it.
I know, I gotta, okay. So, skip down, skip a paragraph, and then go to following menopause. The ovary atrophies and the follicles disappear with increasing age, because you don't have as many hormones. So, and you're not ovulated, so the follicles don't need to grow, and so that you don't see as many follicles, and the ovary will shut down. It's not as it won't shut down all the way, but it'll get smaller. It's just not working as much as it used to, you know? So when you don't use your muscles, they like kind of wither away. And then for this reason, whenever you're looking for ovaries in a postmenopausal patient, that's a whole other challenge. And then a postmenopausal patient having hysterectomy, that is, I've tried to do that before. Oh my lord, that is hard to do, even when it's transvaginal. Okay, next page. In the adult menstruating female, a normal ovary may have a volume as large as 22 cubic centimeters cubed. Think about that whenever I have to think about it. Think cubed. Bless you. With a mean, they typically are around 9.8 cc's cubed, but they can be up to 22 and it still be considered normal. However, if the ovarian volume is more than double that of the other side, then even if, say if one ovary is like 8 cc cubed, and then the other one is like 21 cc cubed, even though that one that's 21 is less than 22, it's more than double the other one, so it's still considered abnormal. Okay? Okay. And then you guys just highlight down to where it says be considered abnormal regardless of the actual size. And that's it.
Where's that?
Page 1003, highlight the first 1, 2, 3, 4, 5, 6, 7 lines. And that's just talking about the size.
No.
Ovary should be less than 22 centimeters, cc cubed, and they should be less than, not double the other side. Okay? Don't get your homework. I sure you did. We're not going anywhere. We're up here.
Are you going to grade our assessment for an hour?
Yeah, you can stay in here
That's
with
what I was
us.
about to say, you can volunteer, but somebody's gonna have to pay for you, Jackson.
I would do it, yeah, I don't care.
Well, yeah, you can watch while you're being. That's what, no, I'm saying.
Everybody would watch her do.
I know, I was gonna, but would be beneficial, her, somebody would have to lay so she could see.
Are you volunteering, Lauren?
No. I ain't had one, I ain't doing one.
You got a baby either.
Mine was a
You got a baby? Yeah. You got a where, girl? What you got?